mula sa ating media. Kailangan po natin madaliin ito dahil kailangan ko pong bumalik sa IATF meeting na ongoing po ngayon. Last week, we informed the public that we have been able to ramp up testing with the addition of institutions that have been accredited by the Department of Health to conduct tests for COVID-19. With government now focused on expanding testing and local governments now also in a position to conduct their own tests, we would like to touch on some of the guidelines regarding testing. Una, ito ang ating general guidelines ng revised interim guidelines on expanded testing for COVID-19. Number one, COVID-19 expanded testing is defined as testing all individuals who are at risk of contracting COVID-19 infection. This includes the following groups. Number one, suspect cases, or two, individuals with relevant history of travel and exposure or contact, whether symptomatic or asymptomatic. And number three, healthcare workers with possible exposure, whether symptomatic or asymptomatic. Ang expanded testing ay ang pag-test po ng mga individual na malaki ang posibilidad na nahawa sila sa COVID-19. Kasama po dito ang 1. Suspect cases, 2. Mga tao na galing biyahe o may nakasalamuha na taong may COVID-19, may sintomas man o wala, at pangatlo, mga health workers na may posibleng exposure sa taong may COVID-19, may sintomas man siya o wala. Indiscriminate testing beyond close contacts of a confirmed COVID-19 case is not recommended. Ang pagtetest ng mga taong hindi naman nakasalamuha ng taong may COVID-19 ay di nirerekomendang sumailalim dito. Number 2, the following reflects the subgroups of at-risk individuals arranged in order of greatest to lowest need for testing. Ito po ang mga grupo ng mga individual na nakaprioritize sa pagtest. Subgroup A, mga pasyente o healthcare workers na may severe o critical na sintomas at may kasaysayan ng biyahe o contact sa kumpirmadong kaso ng COVID-19. Subgroup B, mga pasyente o healthcare workers na may mild na sintomas galing sa biyahe o nagkakontak sa kumpirmadong COVID-19 na kaso at kinokonsiderang vulnerable. Subgroup C, mga pasyente o healthcare workers na may mild na sintomas galing sa biyahe o nagkakontak sa kumpirmadong kaso ng COVID-19. And subgroup D, mga pasyente o healthcare workers na walang sintomas, pero may kasaysayan ng biyahe o contact sa kumpirmadong kaso ng COVID-19. Due to global shortage of testing kits and limitation in local capacity for testing, there is a need to rationalize available tests and prioritize subgroups A and B. However, in view of the expansion of testing capacity and to ensure healthcare workforce safety, subgroup C will be tested and yung healthcare workers natin prioritized. Okay? Mamaya, babasahin ko yung sa subgroup D ha. Yung subgroup D, yun naman yung mas kilala nating PUMs, no? Nandyan pa rin sila. So, relax lang. All subnational laboratories are directed to allocate between 20 to 30% of their daily testing capacity for health workers and the remaining 70 to 80% for patients. Dahil may global shortage ng testing kit, kinakailangan nating i-prioritize ang paggamit ng test. Ngunit, dahil may expansion ng testing capacity at may pangangailangan na igarantiya ang kaligtasan ng healthcare workers, ang subgroup C ay itetest at ang healthcare workers ay ipaprioritize. Lahat ng subnational laboratories ay inaatasan na ibahagi ang 20 to 30% ng kanilang daily testing capacity para sa mga health workers at ang natitirang 70 to 80% para sa mga pasyente. Number 6, based on current available evidence, real-time polymerase chain reaction o yung mas kilala natin na RT-PCR testing dun sa laboratory is the confirmatory test. In the Philippines, this pertains to using RT-PCR test kits that are approved by the Food and Drug Administration or FDA and validated by the Research Institute for Tropical Medicine or RITM. Number 7, rapid antibody-based test kits. Ito naman yung rapid test kits na antibody, shall not be used as standalone test to definitely diagnose or rule out COVID-19 because these must be used in conjunction with RT-PCR tests. Care must be exercised to not unduly consume RT-PCR test kits for the sake of confirmation. Reporting of confirmed and recovered cases shall continue to be based on RT-PCR testing in accordance with Administrative Order 2020-0013. Only rapid antibody-based test kits approved by the FDA and locally validated by the RITM or the Department of Science and Technology may be used. Batay sa ebidensya, ang RT-PCR testing na aprobado ng FDA at RITM ay ang siyang confirmatory test. Ang mga rapid antibody-based test kits ay hindi gagamitin mag-isa para makumpirma ang COVID-19 dahil kailangan itong gamitin kasama ang RT-PCR na test. Dapat mag-ingat na hindi masayang ang RT-PCR para sa pag-confirm ng mga kaso. Tanging ang mga rapid antibody-based test kits na aprobado ng FDA at RITM or DOST ang pwedeng gamitin. Itutuloy ang pag-ulat ng kumpirmadong at recovered na kaso base sa RT-PCR. Now, yung disposal. Number 10, disposal of test kits, including PPEs and other materials used in testing, shall adhere to existing guidelines on the management of healthcare wastes. Ang pag-dispose ng test kits, PPEs at iba pang materyales ay gagawin batay sa istriktong panununtunan sa pagtatapon ng healthcare wastes. Number 11, expanded use of point-of-care rapid antibody-based test kits through validation and sero-epidemiological studies shall be explored for subgroup D. Ito naman yung sa PUMs, no? As testing all asymptomatic contacts of confirmed cases using RT-PCR is not recommended until there is a surplus testing capacity. Results of such validation and sero-epidemiological studies shall be submitted to DOH and to the Health Technology Assessment Council or HTAC for their review and consideration. This should inform future prospects of financing of DOH and PhilHealth since both agencies may only finance or reimburse COVID-19 test kits that have been positively recommended by the HTAC as required by RA number 11223. Ang paggamit ng point-of-care rapid antibody-based test kits sa validation at sero-epidemiological studies ay kokonsidera para sa subgroup D dahil ang pag-test ng lahat ng contact na walang sintomas na kumpirmadong kaso gamit ang RT-PCR ay hindi nirekomenda. Ang resulta ng validation at sero-epidemiological studies na ito ay ibibigay sa DOH at sa Health Technology Assessment Council or HTAC. Now, please allow me to share some of the specific guidelines of the revised interim guidelines on expanded testing for COVID-19. Letter A. The following guidelines shall apply once the FDA-approved antibody-based test kits have been validated by RITM and other designated institutions. Letter B. So ito yung para sa antibody-based test kits, ha? Only licensed medical doctors may request and administer antibody-based test kits. Okay? Mga lisensyadong doktor lamang po ang pinapayagang mag-request at gumamit ng antibody-based test. Letter C. Para sa mga healthcare workers. 1. Lahat ng healthcare workers na may sintomas ay dapat i-isolate at i-test gamit ang RT-PCR test. 2. Lahat ng healthcare workers na walang sintomas na may unprotected exposure ay dapat i-isolate at i-test gamit ang RT-PCR. Kung walang RT-PCR, pwede silang i-test gamit ang mga antibody-based test tuwing 14 na araw or 14 days at i-clear para magtrabaho kung ang IgM and IgG ay negative o kung ang IgG ay positive o kung ang RT-PCR ay negative. Letter D. Para sa mga individual na may sintomas at hindi naman healthcare worker. 1. Testing of all symptomatic patients who are close contacts of a known or probable case must be conducted by health workers equipped with PPEs, personal protective equipment. Patient must be isolated at all times. Ang pag-test ng mga close contacts ng isang known or probable na kaso ay dapat gawin ng mga healthcare workers na nakasuot ng PPE. Number 2, testing of symptomatic patients who are close contacts of a known or probable case with rapid antibody-based test kits alone is not recommended. No? If there is no available RT-PCR, validated rapid antibody-based testing that detects both IgM and IgG may be used. However, regardless of results, no? This is important. Regardless of results, patients should remain isolated for 14 days or until asymptomatic, whichever is longer. Hindi inirerekomenda ang pag-test ng pasyente na close contact ng isang known o probable case gamit ang rapid antibody-based test kits lamang. Kung walang RT-PCR, maaring gamitin ang validated rapid antibody-based testing na nakakadetect ng IgM at IgG. Okay, letter E. Para sa non-healthcare workers na walang sintomas. 1. All asymptomatic non-healthcare workers who are close contacts of confirmed cases need to complete 14 days of quarantine from the date of last contact with the confirmed case either at a temporary treatment and monitoring facility or home quarantine if and only if merong solo room and toilet regardless of rapid antibody-based test results. If symptoms develop at any time, collect samples for RT-PCR testing. Number 2. Rapid antibody-based testing may be used for asymptomatic non-healthcare workers who are close contacts of confirmed COVID-19 cases, provided rapid antibody-based kits are validated, PPEs are available for the healthcare worker performing the test. Okay. 3. For settings where resources permit and there is sufficient availability of rapid antibody-based testing kits and PPEs, testing may be done twice. Ito yung sinasabing double tap or double test, no? The first, this is for rapid antibody test kits, The first must be done at the time of isolation, but preferably at least 5 days from exposure. Kasi dito lumalabas yung antibodies mo based on science. And the second one, or another, on the last day of quarantine. So yun yung 14 days. So 5 days and 14 days. Number 4, for settings with limited availability of rapid antibody-based testing kits and PPE, testing may be done only once during, and it should be during, the 14th day from contact with a confirmed case. Okay? Pero all in all, sa lahat ng sinasabi kong ito, dapat isolated. Isolated yung PUM na yun. Okay? Number 5, if there are no available rapid test kits and or PPE, patients can be released from quarantine after 14 days as long as the patient remains asymptomatic. Okay, pero marami naman tayong na-order na rapid test kits, so this should not be a problem. But ito, number 5, just in case lamang. Okay, letter F. Para sa ating mga kababayan na galing abroad o returning overseas Filipinos, ito naman po ang guidelines. Number 1, lahat po ng OFs or overseas Filipinos na umuwi sa Pilipinas galing sa ibang bansa na may community-based COVID-19 transmission, halos lahat naman ng bansa meron na, no? Ay kailangan dumaan sa mandatory 14-day quarantine. Number 2, pwede pong i-test ang OF gamit ang antibody test pagpasok sa quarantine facility at pagkatapos ng 14-day quarantine period para sa appropriate action sa pag-discharge. Okay? So, all OFs to Wala akong sinabing OFW. Ang sinabi ko, all OFs, overseas Filipinos. Letter G, for surveillance of areas with suspected COVID-19 community-based transmission. Number 1, expanded testing in areas with suspected COVID-19 community-based transmission can be performed at the household, purok, and barangay level with a proper sampling methodology in collaboration with the Epidemiology Bureau and local health officials. Ito yung para sa surveillance, no? Ang expanded testing sa mga lugar na may suspected COVID-19 community-based transmission ay pwedeng gawin na sa level ng tahanan, purok at barangay gamit ang tamang sampling methodology sa tulong ng Epidemiology Bureau at local health officials. Number 2, dapat gamitin ang isang properly validated antibody testing kit para dito. A, pending availability of PRNT validation by RITM, all who intend to conduct their own validation studies are requested to, number 1, register their studies through COVID-19RDT@gmail.com. COVID-19RDT@gmail.com, including updates on the status of ethics approval. Number 2, use the protocol for local validation study for asymptomatic contacts provided nasa Annex C ng guidelines. And number 3, you must report the testing results. Okay. Pangatlo, Testing of asymptomatic people should be performed with proper safety precautions, including hand hygiene, use of appropriate PPEs for conducting the test, respiratory hygiene, waste disposal, and patient care equipment. Dapat po maghugas ng kamay, gumamit ng PPE pag nagtetest na mga individual kahit na walang sintomas. At dapat i-dispose po ng tama ang mga PPE at iba pang kagamitan na ginamit sa pagtetest. Lastly, all asymptomatic patients should be referred for RT-PCR testing and isolated accordingly. Lahat ng pasyenteng may sintomas ay dapat ipatest gamit ang RT-PCR at dapat ma-isolate agad. So, before wrapping up, just a few reminders for our viewers. Pinapaalala lang po ng Department of Interior and Local Government ang mga guidelines sa paggamit na ibinigay na 6.197 billion peso bayanihan grant to provinces. Sinabi sa DBM, Local Budget Circular number 126 dated April 13, 2020 na ang BGP, ito naman po yung sa provinces, no? Nauna na yung nabigay yung para sa cities and municipalities, ito naman po yung para sa provinces. Ang BGP ay gagamitin para lamang sa COVID-19 response. At ito ay subject pa rin po sa umiiral na patakaran sa procurement, budgeting, accounting, and auditing rules and regulations. Saan po pwedeng gamitin ang BGP? Pwede po itong gamitin na dagdag pondo para sa mga ospital na pinapatakbo ng provincial government. Para sa COVID-19 related expenses tulad ng pambili ng PPE, para sa equipment, reagents at kits para sa COVID-19 testing, para sa gamot at bitamina, at para sa ospital equipment at supplies, para pambili ng disinfectant, sprayers, at iba pang disinfecting supplies at misting equipment. Okay. Pwede rin gamitin itong BGP para sa pagkain, transportasyon, at accommodations ng health workers at tauhan ng ospital na pinapatakbo ng provincial government. At mga gastusin para sa construction, repair, lease at rental ng karagdagang lugar o building para sa pasyente ng COVID-19 o suspected cases. Pwede rin itong gamitin para sa training ng medical health personnel basta ito ay konektado sa COVID-19 response. The DILG also says that the BGP can cover expenses for the operation and maintenance of duly established provincial checkpoints related to COVID-19, such as provision of food, medicines, vitamins, PPEs, and disinfecting supplies for the exclusive use of provincial government employees and personnel concerned. Another reminder from the DILG pertains to a memo they recently issued to LGUs, one in which they advise LGUs to discontinue the use of limited window periods with regard to access to public and private establishments like wet markets, supermarkets, grocery stores, and pharmacies. The DILG says, and I quote, "The imposition of such restrictions further creates congestion of people who flock to these establishments at the same time and poses risk to the implementation of social distancing, scheduling and/or clustering of the communities and/or barangays who may be allowed to go out instead is highly encouraged." So, scheduling or clustering of communities or barangays. So, bale, ina-advise na po ang mga LGU na wag na po mag-impose ng maiksing window times para makapunta po ng grocery o botika ang mga constituents ninyo. Sinasabi po ng DILG na mas mainam na i-schedule o i-cluster ang mga barangay para hindi sabay-sabay lumabas ang ating mga kababayan. Mas mahabang oras ng bawat tao lumabas, rotational po ang areas na pwedeng lumabas para mas konti ang tao na nasa labas at a given time. Speaking of LGUs, I'm happy to report that according to the DILG, all LGUs in Metro Manila now have an anti-discrimination ordinance or executive order in place. May babala din ang NBI. Ang babala ng NBI, ang lahat ng uri ng pananakot, diskriminasyon at pananakit sa ating mga frontliners ay may karampatang parusa. Pwede nyo pong i-report sa NBI kung ikaw man ay nakaranas o nakasaksi ng mga ito. Tumawag o mag-text sa mga sumusunod na numero para sa Globe subscribers 0996-472-3056, sa Smart 0961-734-9450. Ang regional number 0975-153-9146 at landline 02-852-40237. Salamat po sa ating mga mayor sa Metro Manila at sa NBI. As of yesterday, we have tested a total of 52,837 individuals. The latest data shows that we have 172 new confirmed cases of COVID-19, bringing our national total to 6,259. 12 more lives yesterday were claimed by the disease, bringing to 409 the number of people who have succumbed to COVID-19 in the country. The total of recoveries is now 572. As 56 more people recovered from the disease yesterday. Tuloy-tuloy pong gumagalaw ang mga sangay ng gobyerno upang tugunan ang pangangailangan ng taong bayan. Maraming salamat po sa mga LGU na kasangga ng gobyerno sa laban na ito at maraming salamat uli sa ating mga health workers at frontliners na walang tigil na nagtatrabaho at nagsasakripisyo para sa ating lahat. Tumbasan o suklian po natin ang pagsisikap nila para sa atin. Maghugas ng kamay, ugaliing gumamit ng mask kapag lumalabas ng bahay at hanggat maaari, manatili sa ating mga tahanan. Bahay muna, buhay muna. Together with God's grace and mercy, we can beat COVID-19. Together, we heal as one. Maraming salamat po. Sa mga katanungan sa media, parang napansin ko po na karamihan ng mga katanungan ninyo ay tungkol sa anong gagawin sa after April 30. Gaya ng sinabi ko, ongoing po ngayon din, ang IATF meeting. Umalis lang po ako sa meeting para makapagbigay ng press briefing. Pero pagkatapos po nito, again, pagpaumanhin po ninyo, hingi po ako ng dispensa at pasensya po sa inyong lahat, kailangan ko na po talaga bumalik sa meeting ng IATF. So sabihin ko na lang na dito sa mga katanungan ninyo, karamihan ng mga katanungan ninyo ay masasagot natin siguro within the day and or masasagot pag nagbigay na po ng pronouncement si Pangulong Duterte. Kaya pasensya po, kailangan ko na pong bumalik sa IATF meeting at dahil ngayon pong pag-uusapan kung anong gagawin natin, anong mga rekomendasyon ng IATF kay Pangulong Duterte para dun sa anong mangyayari after April 30. Muli, itong mga rekomendasyon namin is subject to the final decision ni Pangulong Duterte. Kaya puro recommendation lamang ito. Ultimately, si Pangulong Duterte po ang magdedesisyon. Ang hiningi ko lang po sa ating mga kababayan, anuman ang maging desisyon ng ating Pangulo, alam ninyo na ito ay base sa mga parameters na naiset na po natin, yung epidemiological curve, ang ating healthcare capacity, ang ating social factors, economic factors, at peace and order and security factors po natin. So base sa 5 parameters na to ay magdedesisyon po si Pangulo. Kaya abangan na lang po natin kung ano man yung mga desisyon niya, at hinihingi ko lang din po na lahat po tayo ay sumuporta sa anuman ang maging desisyon ng ating mahal na Pangulo at ng ating pamahalaan. Sa mga may-ari o gumawa ng mga material na aming ginamit sa slides kanina at sa mga nakalipas na pressers, maraming salamat po sa inyong tulong sa pagpapaintindi sa ating mga kababayan sa kung ano man ang pinapahayag natin ngayon. Sa ating mga kababayan, maraming salamat po sa inyong pakikipagtulungan, sa inyong pamahalaan. Kayo ang first line of defense sa gyerang ito. Bahay muna, buhay muna. Huwag po kayong maniwala at magpakalat ng mga impormasyon kung ito ay hindi beripikado na mula sa mga ahensya ng gobyerno. Marami naman pong kumakalat dyan. May mga audio, video at kung ano-ano pa. Huwag niyo na pong patulan yan. May katumbas pong parusa ang mga gumagawa nito. Sa ating mga kasama, sa pagpapalaganap ng tama at napapanahong impormasyon sa iba't ibang mga media outlets sa TV, radyo, dyaryo at online na nakahook up po sa amin ngayon, maraming salamat po. Salamat din po sa Google Philippines, Facebook Philippines at YouTube. Muli, abangan na lang po natin kung anong magiging latest developments. So, paalam na po. Babalik na po ako sa IATF meeting po namin. At abangan na lang po natin kung ano yung maging kinalabasan nitong lahat ng ito. Kaya magandang umaga po muli. God bless, amping kanunay. Padayon sa inyong pag-ampo, maing buntag sa tanan.
COVID-19 special.
March 24. Tiniyak ni